Hi, good afternoon. Thank you so much for joining us today, and thank you so much for the Chamber Foundation and Corporate Citizenship Center for inviting us all for this panel, and really excited to talk with the women up here today. I am Jessie Matton, and I'm the Director of Corporate Social Impact Policies at the National Partnership for Women and Families. We, in our approach, center the lived experiences of women in their lives and in the way that we approach our work. So we're thinking about how we provide equity through economic justice and health justice to help women thrive and participate in the economy fully. But that thrive piece is something that I think that really is what drives a lot of the passion for our work. And I am very excited today to be covering really just the massive opportunity and the exciting things that are happening inside the companies and within our partnerships around women's well-being, and how we're thinking about it a little bit more holistically in terms of the correlation between health and economic participation. So first, I'd love to introduce our panel. We've got Dr. Susan Harvey. Thank you for providing those remarks before this. Dr. Julie Gerberding, Taryn, Ann Chapman, and Taryn Bird. And first, I'd love to go ahead and just start with a little bit of a broader conversation to set the stage around the current status of women's health when we're thinking both domestically and globally. But I'd love to turn to Dr. Gerberding and Dr. Harvey first, if you'd be open to talking about, you know, what is our current status in your opinion? Where are we falling behind? Where are we seeing some successes?
Jump in and start, and thank you so much for doing this and for including me in the panel. This is such an area of passion for me, and I wish we could be celebrating, but unfortunately we're in a situation where the status of women's health is not great and not getting better in many, many dimensions, as you heard from the context of the Global Health Index. Why is that? In the short run, some of that has to do with the pandemic and the disproportionate impact on women. But I think broadly speaking, this is just part of an ongoing, long-standing trend in the United States and elsewhere around the world. And it stems from, obviously, the intrinsic health disparities, but they also are built upon the social disparities and the economic disparities that are still part of our societies. So it comes through the lens of gender, it comes through the lens of race and ethnicity, it comes through the lens of geography, and it comes through the lens of just basically all of the global issues that are surrounding so many men and women in various parts of the world. I think the specific health problems we can go into, but there really isn't an area of women's health where we've seen tremendous improvements. Isolated cases in a few countries, there have been some success stories, but I think overall the things that are most important to individual women in their health status and the things that are most important from an epidemiologic perspective and what's killing women or what's interfering with the quality of their lives, those big issues really haven't been solved. And yet, from my standpoint, I say this sort of from someone who's now very close to the NIH and all of the incredible research that's going on there, they are solvable, but it takes more than the science. It takes the commitment, the investment, and the participation of a whole of society in order for us to really recognize and do something about them.
Dr. Harvey?
And I'll hop right in. You know, the COVID pandemic really laid this all bare, right? We began to really see the inequities that were present. And I'm optimistic we'll learn from this, and we will focus our attention and our dollars and our policies toward this. The UK is a nice example, right? They have put together a women's health plan, and they've put funding forward. So that's one good example. In regards to how devastating COVID was, it collapsed many health systems. In New York City, we saw this. And we saw it happen dramatically in India. India was devastated. More than 50% of the women reported to us negative emotional health. which links to physical health and mental health that we'll hear a lot about today. So while gaps are increasing, these are solvable, and part of it is having data to guide us, data to inform decisions to move forward, to target areas that need to be targeted, and how to move forward. Each country will be unique in the resources that they have and the priorities they have for their population. But as we use data to make these decisions, progress will happen. They're solvable. We can do this together. Thank you.
And Taryn and Anne, you both come with a little bit more of an extra underline under the mental health piece. And I think a lot of times, when we're thinking about company approach, there is the business case always with our work. And one of the stats that I have found to be really startling in regards to productivity is globally a $1 trillion loss for anxiety and mental health. And I'd love to hear you both reflect on kind of your take in terms of the current status when you're thinking about mental health as it intersects with women's economic empowerment.
Sure. I think the pandemic, Yeah, you go ahead. I think mine's on here. Hello. Thanks very much, appreciate it. The pandemic absolutely had a significant impact on everyone's mental health. I know we all felt it. Our lives changed drastically overnight, and I don't know that we've seen the full effects of that just yet. On average, an individual that develops a mental health challenge has about a 10-year gap between developing the challenge and actually accessing the resources that they need to move towards recovery. And we've seen some pretty startling data focused on women in the workplace around sort of current state. 2022 report by Deloitte surveyed about 5,000 women across 10 different countries, and 53% of them expressed that they were experiencing more stress in the workplace in 2022 than the year before. 50% of those women expressed experiencing burnout and rated their mental health as poor or very poor. And that is significant. And we're talking about, sort of 3 years later. There's always the chance, particularly without access to care or resources, that number continues to rise. And I think one of the things that's really startling for me within that report is that 43%, only 43% of those women said that they felt comfortable talking about mental health or talking about the resources that they needed for it within their workplace. If you think about the amount of time that we as adults spend within the work environment, the fact that our resources typically come through our employers, if we can't talk about it, if there's still all of that stigma around supporting ourselves and supporting our colleagues, how are we going to shorten that gap, right? So at the National Council for Mental Wellbeing, we truly believe that mental health is health. You need to care for them both equally. And that starts with being able to talk about it and access the resources that you need.
Thanks, Anne. Hi, everybody. It's really nice to be with everybody today. This is a real full circle moment. My career started in the chairs that y'all are sitting in, and I would have never thought so many years ago I'd be on this stage talking about women's mental health, and a kudos to the Chamber for bringing a topic forward that's highly stigmatized, not only in the workplace, but just globally. So thank you to Mark and his team for that. And just building off of what these ladies have been sharing in regards to the global statistics for women's health, we aren't going in the right directions, and there are really severe implications to the economic empowerment work that we all do. And something that we've really seen at Kate Spade, New York, we are a fashion brand. You probably know us for our handbags, but we're a brand that believes in the power of joy, that believes that joy is something that's an inherent right for all of us, and that mental health is a really important component to that. And as we're talking about the vital role that mental health plays in the empowerment of women and girls globally, it's not a topic that we're really talking about or, quite frankly, gets funded. And so a question often that I like to I have asked myself this many times, but I think it's also a good question to kind of sit with when we think about the interconnected and the intersectionality of these two issues is, if you yourself are living with a mental health condition, or you love someone who has a mental health condition, has that mental health condition impacted their voice, their choice, and their power? And when we think about empowerment, it's a very simplistic way to look at that, but I can say for myself, as someone who's living with a mental health condition and also had family members who have lived with mental health conditions, that the answer to that question is yes. And so we're just really focusing our efforts on not only providing resources to mental health resources for women and girls, I just said resources twice, mental health resources and access for women and girls globally, but to really start to talk about this issue in a really meaningful way. As Annie mentioned, mental health is health, and I think something that you so beautifully detailed during your presentation about that pain gap, when you said that like landed in my body so much, because I think so many women experience that not only from a physical perspective, but from a mental health perspective, that our stories are true, that our experiences are true, that they're informing how we're living in the world. And that it's a really, really important component of not only how we're showing up in our families, but how we're showing up at the workplace.
And that leads us really nicely. I think the pain gap is something that, whether you've felt it on a personal level, kind of this silent feeling, but having these gaps really be validated and through data, I think is one of the pieces that is so critical when we look at the field of women's health and mental health and physical health, and thinking about how we can support, fully thriving lives. I love the way that you think about the voice, choice, and power. But we know that women's health is drastically under-researched, underfunded. When we are talking about these gaps and how really how many persist in women's health research, how does it impact your services, approach, and products when you think about how you're looking to provide and really reach women at the core here? And Dr. Gerberding, I'd love to hear your take first.
Thank you. I work now for the Foundation for the National Institute. One of the things we do is to support private-public partnerships in service of the NIH's mission, but also in an effort to try to push the envelope. A big area there is precision medicine. So much of medicine is built on the background of studies and clinical trials in white men, and of course, that we need to do more to try to bring that into a much more diverse and equitable state of clinical research. So one whole dimension really relates to inclusion in the process of research, so that the results that we're getting are relevant to women, but also to people of color and people in other segments of our society. But I think a broader issue really relates to the recognition, in a sense, that women are not about their body parts. We're not about breasts and uteri. Women's health is holistic. It's about cardiovascular disease and stroke. It's about diabetes and obesity. It's about reproductive health, and it is about cancer, but not just breast cancer or uterine cancer. It's about colon, lung, skin, and every other kind of cancer. And what I'm really saying is it's a comprehensive constellation of physical well-being and wellness that is, again, more than the sum of body parts, and is more than the sum of our gender-related body parts. So we have to really be mindful, as a clinician, as an internist, certainly mindful that when I was in practice taking care of patients in the outpatient setting, that I didn't just look at women through the lens of their maternal or their reproductive health. But I think that also comes through in things like insurance and access to care. Our insurance policies are even in privately insured people with reasonably good employee-based insurance coverage, the insurance design plans are not really built to be comprehensive and to really encourage the kinds of prevention opportunities and the health-sustaining, mental health-sustaining activities that really would benefit women and men as well, but in particular women, because they have the disproportionate burden of so many additional stressors in their lives. So one part is getting the data, and the other part is thinking about the data in a holistic way, and another part is assuring that you have the ability to do something about the data through the kinds of systemic and contextual requirements for being able to access services wherever they are. I don't want to comment right now on the quality of services, but I think that's a fourth dimension that we need to look into. I'm particularly interested in maternal health, in part because of my previous work at Merck, where we had a big $500 million investment in global maternal health. But now at FNIH, we also have been part of a study on global maternal mortality related to sepsis. And in the course of thinking about that, just realized that, that is an area where, again, we know what to do, but we just simply don't have the resources and the kind of systemic support that we need for women in America, as well as women in other parts of the world, to assure that they can have healthy pregnancies and healthy babies at the end of the day.
And Dr. Harvey, I'd love to hear from you on that in regards to how it's impacting your approach at Hologic and any innovative solutions that have really gotten you excited.
Well, thank you. And building off the point of data, anyone who's ever tried to collect a standard data set will understand, even in the US, that is tremendously difficult. Just imagine what it would be like in a low-resource country where things are handwritten or not recorded and people don't know their birth dates. So as we look at the Hologic Global Women's Health Index, this was a survey asking women, either one-on-one or by telephone, about their own health. And what this begins to get at is empowerment of women. What can women actually do to access care? And that is very different around the world. In the United States, there are racial disparities that are pretty unbelievable. And so as we think about data, this empowerment of women and the agency to take action really pairs nicely with those standard data sets. And when I think about innovations, one thing is health literacy. Just think what cell phones have done here in the US and globally about information. There's a stat that about 80% of people in India who are attending a doctor's appointment, a healthcare provider appointment, so that is not 80% of India, but 80% of those who can get access, look up something about the reason that they're going to the doctor before they go to the provider. That's incredible. There are really nice apps that connect patients and providers by cell phone. We can think about artificial intelligence, and that is an incredibly complex area that's helping with accuracy, but also access. And we can also think about digital opportunities. COVID showed us that we could do remote video doctor's appointments. And while they're not entirely effective, they're often better than nothing. And then going even farther afield, drones that deliver medication or deliver samples from biopsies to centralized care patterns. And then we can think about simple things. When I was at Hopkins, we realized that our letters for women who had an abnormality on a screening mammogram that needed to come back were written at the 12th grade level. And so many people did not understand them. All we did was rewrite them to be clear about the direction, come back in, and to be written so they were comprehensible. We got up to 95% of women to return after we did that. Super simple. And rather than an automated telephone a person got on the phone to remind women. So innovations span things that are very simple to very complex, and yet they will help us solve the challenges that we are facing today. So I look forward to everybody's innovative thoughts about what comes next.
Please.
I'm going to build on something that Dr. Harvey just mentioned, the piece about how you went about the survey and, you know, doing the one-on-one, like the one-on-one conversations with women and the importance of co-regulation when you're talking about a highly stigmatized or an issue that has a lot of charge. And, you know, it made me reflect and think about, over the last 10 years, part of our social impact portfolio was an investment in a Rwandan manufacturing facility. That's an employee-owned, women-led manufacturing facility where this year we made our 257,000th handbag in East Africa. And as part of that, we're using our supply chain to very strategically empower a small business that's then empowering women at that facility with full-time employment and access to healthcare for them and every member of their household. But as part of that, you know, I just want to tell a quick story because that co-regulation piece in terms of how we're setting our workplaces up for that, I think is really, really important. And as Kate Spade New York, we are the social impact investor and client to this Rwandan-led business, Abihizi Rwanda. And 10 years ago, when we were starting this initiative, we were investing pretty heavily in some technical training of the workforce there, which is over 90% women. We flew trainers in from different parts of our manufacturing facilities in Asia, and we're really looking to upskill the workforce in higher-end handbag manufacturing. And while we were doing that, myself, along with the Rwandan leadership team, were sitting in a training room one day, and we were like, this workforce is physically here, and they are mentally somewhere else. There's no communication on the handbag line, which if you've ever been in a production facility is absolutely critical for high quality goods to be made. And so at the time, the team was looking to set up a life skills program that was really focused on pretty traditional health literacy as well as financial literacy. About 80% of this workforce, this was their first time full-time job. We scrapped the basic education and for the short term, and we brought in a counselor. There is now a full-time community-based counselor who provides individual and group therapy at that facility for every single member of the workforce. 94% of that workforce voluntarily attends mental health workshops on a monthly basis. And look, I'm not saying that happened overnight. That actually took a number of years before that type of attendance rates were at that level. But that co-regulation piece and that ability to be able to talk about the things that are really impacting women's lives is really, really important, and services like mental health first aid are so critical to empower our organizations to be able to do that. But I just share that as an example because I think it's really, really important for us also. I think there's probably a lot of funders in this room, a lot of us who are responsible for, you know, deploying social impact capital and philanthropic capital in very strategic ways. And I think that's where our social and philanthropic capital can really start to fill in the gaps where there aren't those structural pieces in place with the high quality care that should be there. So just share that was definitely something that we saw a really big impact in bringing in a mental health intervention to a very traditional economic empowerment program. And we've since taken that approach and applied it to the balance of our social impact portfolio. But that really informed how we were looking at how critical this issue was to seeing women utilize higher levels of voice, choice, and power.
It's so interesting to hear about, you know, we were talking on our speaker call about these, like the short-term wins and how you're measuring impact and how eventually you really need to have these check-in moments to recognize like when you need to pause something that you knew is a priority and pivot to having a counselor, like whatever that might be. And I'm curious in regards to the mental health at work, you know, that must lift a veil in regards to the conversation in the workplace and how you show up for yourselves and others. And I'd love to hear you talk a little bit more about that as we are thinking about the gaps.
Yeah, absolutely. And Taryn, I love that example and that story. You know, the challenge that the workers were facing was deeper than what might have initially seemed. And we're talking about some really big issues here. We're talking about big data and what do we do about it, and we're talking about health literacy, and it can seem overwhelming, but the fact of the matter is that there are true tools out there that can support in moving the needle in this space. Mental Health First Aid is a program that you can think of it very similar to CPR, in that a layperson kind of learns the basics around a health issue. Mental Health First Aid is focused on mental health, so it's a public education program where you learn how to identify the signs and symptoms in someone in your life that might be experiencing a challenge, and then empower you with some tools on how you could intervene and awareness around the resources that are available. And it's available in 25 countries across the globe. We talked a little bit about workforce challenges. There's always a workforce shortage in healthcare writ large, and particularly right now in mental health. So how can we think about empowering our communities, internal to our business, internal to our families, more people that are aware, that are literate in mental health challenges, that know how to have supportive and encouraging conversations, and know how to connect people to the resources that they need. We want to think about shortening that gap between developing a challenge and accessing the care that we need. And I think one of the greatest things, Taryn and I have been partnered for many years. The National Council for Mental Wellbeing and Kate Spade New York collaborate really frequently, but I think the great thing about the story for Kate Spade New York was they started internal. It was an employee initiative. They wanted to address the mental health challenges internal to their organization, create and foster that culture of well-being and support. I talked about some of the statistics earlier around poor mental health in the workplace. That resiliency building and addressing burnout is so crucial right now. But what I love about what Kate Spade has done is that they've now sort of reoriented their lens. They've addressed their internal needs, and now they're working on how can they bring those resources out into their community. And they've made significant commitments to bringing resources like Mental Health First Aid into the New York City community, where they really have such a strong presence and voice. And I think when we talk about that private-public partnership, there's just endless opportunity there.
Yeah, there is absolutely a level of just kind of that moment where you need to turn to the resources and the experts around you that can help you understand how to approach your problem differently. We all know this on an individual level when you turn to your friends and mentors for this, and then you have to think about this on a, an ecosystem and an organization-wide level. It's obviously much more complex, but the value of when you're looking to really create an impact, the value of that perspective and the data behind it is so, it's really priceless. And I'd love to go a little bit more in terms of the impact element that we were talking about and that Taryn kind of kicked off is, how has success come to form for you and your work? What are some examples that are really getting you excited about progress around, your individual areas of expertise, and also how are you measuring it, both in the long term, because we know that all of this is such a complicated process in regards to impact measurement, and the ripple effect in terms of health investments and the economic kind of domino that happens particularly for women and their families. But I'd love to toss it to y'all to talk a little bit about that.
Thank you. So first of all, just this morning I had a conversation with my own little organization because we were looking at our benefits policies, and it's very clear in our current policy manual that pregnancy is a disability and should be treated like a short-term disability. I mean, I just couldn't believe it when I saw that. It was embarrassing. So I think we all need to take a look at what's actually the current policies within our workplaces and speak up and out, and if we're empowered, do something about the lagging of those policies way beyond what is contemporary in most other developed countries. I think the United States is the only developed country that does not have parental leave policy that is supportive of women and men who are new parents. At a national level in the U.S., we have made women's health a priority. One of the biggest gaps relates to maternal coverage postpartum. In increasing Medicaid coverage from 2 months to 12 months is one of the really important things that will improve the quality of health for women, but also for their newborns. And it's an expensive engagement, but it's really, again, contemporary with the way other countries who have much better health statistics than the United States approach that particular dimension of women's health. But I think beyond that, employers writ large can do a lot. We've already mentioned insurance benefits, parental leave policies that can be modernized and extended for men and women who are new parents, and to make that a normative part of the culture, not something that, yes, it's there on paper, but if you actually try to exercise it, you're perceived as not doing your job or not being strong enough to carry on in all the multitasking that has to happen fast in those kinds of situations. And then I think, lastly, is the mental health. I love the concept of mental health first aid, and I think there's a lot there that we could do in the workplace. We lost 1.1 million women from the labor force related to the pandemic, and many of them are not coming back to work because of the experience of the stress and the complexities of life in the economic environment that we're in right now. But in order to get people back into the workplace and to stay in the workplace, we have to take the concept of flexibility to a much different level and really create an environment that puts health and well-being at the top of the list of the cultural requirements for success. And it's hard. I don't think I'm an expert in it, but I aim to do everything I can to try to be an exemplar of that within my organization.
Thank you for your efforts. It's a big task, but if we just keep gentle, persistent pressure. So success, boy, that's a hard one. How about this? That we close the gaps for women's health around the world, right? And it will take a long time, but let's focus on that. We have data that can bring awareness, can be used to guide programs, and we also have a framework for those actions. And Hologic is committed, and others as well, to annually gathering data. And so that's important to look at trends. We just need to keep listening to women. Women and girls need education. They need to be safe at home in their communities. 9 out of 10 women in the United States told us domestic violence was a problem where they lived. In these one-on-one conversations where there's some sense of security and detection of deadly diseases early. So we can do this. We have to partner, we have to team up across all kinds of bridges. Or I guess we have to make bridges. Sorry, bad use of that word. Private and public partnerships, all kinds of things. So let me not talk anymore and hand over to others.
Please, yeah.
Well, I can speak more specifically about mental health first aid in that we very purposefully build in an evaluation program around the training. We want to see that it's effective, that the learning objectives are coming across, and we focus on things like the learner's confidence to use the skills that they learn and employ them either in the workplace or in the home, a reduction in stigmatized beliefs around mental health. You know, we talked a lot earlier about stigma still remaining such an enormous barrier when we're thinking about addressing mental health. The relevance of what is learned within the trainings and how you can apply it to the workplace. So there's a lot of data, you know, as we're talking about these big issues, we don't want to just put things out there and hope that they work. We want to see how we're doing assess ourselves and improve. But if I could just add one additional thing to what Dr. Gerberding said, we are seeing an alarming rate of women leaving the workforce, and particularly women leaders. And whether they're leaving permanently or thinking about transitioning into a new company or a new role, one of the top factors in what they're looking for is a commitment to well-being and diversity and equity and inclusion. It's required after the pandemic and the experience we've all been through. That is a priority to everyone. And so as we think about building a workforce, creating a workforce where women can thrive and be empowered and feel safe and feel heard, we cannot move forward without addressing well-being. And I'm just so grateful to this whole panel and the tools that currently exist out there that you can use in your workforce and in your community.
I'll close this out.
Yeah.
Okay, cool. Okay, in terms of metrics, the private sector, we love some metrics. And I think the three things, though, that I'll speak to, the first of which is we've heard so many on this stage today also, just so many amazing commitments that the private sector is making to societal issues, to using our commercial resources to generate social good. And I think that that's really important. We've made a commitment to reach 100,000 women and girls with access to mental health resources globally. We're at 66,000, and we should be rounding that number out by the end of 2025. I think the second piece to that, though, is not just about our reach, because also as the private sector, we love to make these goals, and we're really great at meeting them. And that's an amazing, amazing quality. And how are we continuing to advocate on the issues that we feel are really important, not only to us, but the communities that we live and where our associates and our employees live. So I think the advocacy piece, is really important. I think for us, that's about bringing a mental health conversation to every single opportunity that we have a microphone on, and you'll see that more from us, not only from, if you walk into our stores, but also the types of issues that our CEO is talking about. So it's really important to, I think, take a whole of organization and a multi-person approach there. And then the third piece, I'll just mention that if this conversation about mental health and women's mental health was something that was of interest to you all, there's a way that you could help us push that forward. And there's a card on every single one of your chairs. This is a link to a QR code. It's a global research study that we're doing in partnership with an organization called Prospera Global. My colleague over there, Caitlin, is running point on the research. And we are partnering on the world's first global women's mental health and economic empowerment study, looking at the intersectionality between these two issues. We would love to have you participate in the survey. That QR code will go directly to the survey link, and would really, really appreciate if you might take a few minutes to fill that out. And then the last thing I'll just say is that never underestimate, I know we're talking about this on a really big level. We're talking about organizational conversation about women's health, but never underestimate the power of your encouragement or support of a woman has. I was outside on those steps 15 years ago trying to decide what I was going to do with my career, and there was a woman named Lila Jinnah. She's since passed away. She actually died by cancer 2 years ago, 37-year-old woman, amazing social entrepreneur. And she looked at me and she told me that what I was doing was important, and I will never forget that. I will never forget that. And so never underestimate just a compliment or an encouragement has with building somebody's resiliency, because I bet you they need to hear it that day, especially if she is a woman. That's going to really go a long way. So never underestimate the power of that individual connection and support.
Cannot close it out any better than that, truly. Thank you so much for this conversation. Thanks for giving us a few minutes extra time to be able to have it, and please join me in thanking our wonderful panel.